Hi, I am Dr. Vani, consultant pediatric neurologist at Apollo Children's Hospital. Today I am going to try and explain to you about cerebral palsy. What is cerebral palsy? Cerebral palsy is a condition where the immature brain suffers an insult during the child is in the womb of the mother. Whatever defect is sustained during that period results in a condition called cerebral palsy, wherein the child has certain difficulties as they grow up. What are the types of cerebral palsy? So, a cerebral palsy has got different types. The way we classify the types is purely based on a clinical fashion, so how the child presents to us. So, it could be the child has got a weakness on one side of the body, in which case we call it a hemiparesis or a hemiplegia. It could be a weakness with only the lower limbs involved, in which case we call it the diplegia. In some cases, it could be just the upper limbs involved, wherein we call it the reverse diplegia. There are some conditions where the child might have just tone disturbance, as in a dystonia, so it is called a dystonic cerebral palsy. These types of cerebral palsy are based on how the clinical presentation varies from one child to the other. Can the brain heal from cerebral palsy? Not really, no. Brain is a structure which is supplied by arteries that are called end arteries. So, when we have a defect in the brain, in the immature brain, it becomes an irreversible defect. We cannot change the defect, but we can try and encourage the rest of the brain to work better than what they normally do. How common is cerebral palsy? Cerebral palsy is a relatively common condition, especially in developing country like India. We do have a high incidence of cerebral palsy, especially in the rural population, where these children are born without good antenatal care and without good perinatal care. In this, I mean, during the pregnancy, the mother does not get the adequate medical attention and adequate scanning of the unborn fetus, and then during the delivery time, they do not get adequate medical attention, and the child, when it's born, is not given pediatric attention with high oxygen flow if required. So, these are the conditions where you do end up with children having cerebral palsy. What are the early signs of cerebral palsy? So, cerebral palsy, the signs of cerebral palsy are usually from the developmental point of view. The child may not meet the criteria for developmental milestones. So, for instance, a child may not attain rolling over. So, a child is meant to roll over from front to back and then back to front at about 4 to 5 months. They may not achieve that, and then going on from that, they may not crawl at the right age, they may not stand at the right age, they may not walk at the right age. So, these are the usual triggers that usually ask the parents to go and seek medical attention, is when the child is not achieving their milestones. So, what conditions coexist with cerebral palsy? Cerebral palsy is not a standalone condition. Often you do have problems that coexist with cerebral palsy. So, the common problems that we do come across with cerebral palsy are: one, cognitive impairment. So, these children do have some degree of learning difficulties. I do not like the term mental retardation, so I use the term cognitive impairment. So, these children may require some kind of special schooling to improve their learning skills. What causes cerebral palsy? So, the commonest cause of cerebral palsy is lack of oxygen to the developing brain, either while the child is developing inside the mother's womb or during the delivery process, that is during the second stage of labor or just immediately after the delivery of the child. How is cerebral palsy diagnosed? Now, cerebral palsy is a diagnosis that is mainly clinical. So, it depends very much on the clinical history of the patient, how they were born, what was the antenatal history, the perinatal history and the birth history, following which, depending on the clinical examination of the patient, the consultant neurologist or the pediatrician will make the diagnosis of cerebral palsy. Can cerebral palsy be treated? Yes, cerebral palsy can be treated. We cannot cure it, but we can definitely treat it. So there are different aspects of cerebral palsy that needs to be treated. The commonest thing that we advise parents would be to give regular physiotherapy as early as possible. So physiotherapy is a well-known entity for treatment of cerebral palsy to improve their mobility, to improve their activity levels, and to improve their quality of life. Can cerebral palsy be prevented? Yes, to a large extent cerebral palsy can be prevented by good antenatal care, adequate antenatal scanning, and good perinatal care with presence of a good pediatrician during the delivery. When should someone consult regarding cerebral palsy? So, whenever a child does not achieve the milestones that they are meant to achieve at the right age, they should be ideally consulting a pediatrician who will in turn, if required, refer to a neurologist as appropriate. What is the life expectancy of somebody with cerebral palsy? Now, cerebral palsy life expectancy is very variable. Again, it depends very much on the clinical severity of the condition. So, if a child has got very severe problems and is bed bound with difficulty in breathing, of course their life is more limited as opposed to somebody with a very mild cerebral palsy who is mobile, who is attending a regular mainstream school. So, as I said in the previous unit, it is always depending on how the presentation is clinically. So, a mild condition will have a near normal life expectancy. However, a severe condition does have a limited life expectancy, and often the cause of death is from a respiratory cause. So, today we have discussed regarding cerebral palsy, the causes, the types, and how to manage these children with cerebral palsy, what is the best way they can be managed, and what is the best outcome that can be expected from these children. Thank you. So, stay safe, stay healthy, and stay informed. If you are in doubt, please consult your doctor or your pediatrician.